Welcome to Adapt and Lesson. Thank you for deciding to watch this video. If you're planning to take your NCLEX and preparing, I will encourage you to watch this video. Content that you need to know. I will listen to it, write down the topics. If you have a problem with them, go and study them. But you can use this information for LPN and RN. These are areas you have to master them to be able to pass the NCLEX. It's key concepts. I'm not saying you're going to get the same questions, but it's the concept mastering help you answer questions. And then when you practice, it become easy. This is part 2 as promised. Let's go. A quick one, but high yield facts that you need to know. Number 1, I will show you how to answer questions, and then you can pause the video and practice the way I'm trying to. First, read the question from the back, select or apply, right? What is the problem? Select or apply. Go for the buzzwords. Which medication selected by the nurse indicate effective teaching, right? Effective teaching about what? And the LPN has attended staff medication program about the medication for what? Heart failure. Which one, when selected, indicate effective teaching? All I'm saying is, which medications can be used for heart failure? You know, heart failure problem is what? Either too much fluid problem or pump problem. You see, 2 things, PP. Fluid, too much fluid, and pump problem. We got to fix the fluid, we got to help with the pump, and help with contraction. Bumetanide, right? It's the same as furosemide. It deals with the fluid. Chlorthalidone is hydrochlorothiazide derivative. It deals with the fluid. Digoxin is a pump guy, help with pumping the heart. Prenatal, it looks like what? Lisinopril is an ACE inhibitor, help with remodeling. Low dose metoprolol, I know you don't want to block the heart, but low dose metoprolol will slow the heart down and allow it to contract and does its job. When you slow it down, it doesn't allow the heart to move contract very fast. Slowing down, provide blood flow, and help with the output better. So these are all medications you should know can be used in heart failure. Question 1, down. Number 2, same strategy. We read a question from the back. Which is the best course of what? Action by the nurse? It's not first, but it's the best. LPN care for a client who is experiencing what? Dyspnea with oxygen saturation of 88. Somebody has dyspnea, problem breathing, and inside is dropping. I'm asking you the best. But the best answer is to treat the problem. The first answer is to temporize it. If I raise this kid or this patient head up, I'm temporizing it. You know his side is dropping because it's hypoxic. Therefore, elevating the head is not going to completely fix the problem, but that is the first action you do. So when you see first and best, you got to do something better, aggressive, right? Elevating the head is the first action you do. Providing oxygen is the best thing you do. Calling the healthcare provider is not indicated. Listen to the client long. You are making assessment. After you provide them oxygen, you raise the head up, then you can assess the alarm. So number 2 is your best answer. Fix the problem. You don't have time to be listen to the lung. It's not going to help you. Give him something to help with the hypoxia. Which intervention, that means pick an answer choice, that is an intervention, is a priority before first dose of the medication? You see the way I'm answering the question from the back, going for the buzzwords and connecting the buzzwords together. And then provide care for a client with medically refractory what? Rheumatoid arthritis, who now is prescribed Etanercepts. So the 3 things you need to focus upon: Etanercept, first dose, and intervention. The clue, one buzzword that will help you is rheumatoid arthritis. What you use to treat rheumatoid arthritis? Immunomodulator. Therefore, this is an immunomodulator. Etanercept is an immunomodulator. What do you do before you start the medication? Get a chest X-ray, get a CBC, check their temperature, or place markers test. These medications immunomodulate. If you don't, before you start it, you got to make sure the patient PPD is negative. Otherwise, if his PPD is positive and you start the medication, it's going to make them full-blown TB. Chest X-ray is good to look for active TB, right? CBC is not indicated. Temperature, no. And it matters. This is fine. You can have fever all you want. There, I mean, of course, when you're taking etanercept, you should not have infection. Checking their temperature first is not a priority indication. The most serious one is PPD getting reactivated while they're on this medication. The LPN is reinforcing medication reconciliation in an 89-year-old client with what? 2200 vision acuity, which medication should consent the next selected apply. Rewrite the question again. Older patient has 20/20 visual acuity. What does that mean? 20/20 is blindness. So this is legal blindness. Which medication should the next question, right? Should be concerned about. A patient who is blind, what is the major risk? Is 4. Therefore, should not be taking anything that will cause 4. The way to remember them is the best criteria. There's a bunch of anti. Mostly everything that has anti can be given to the antihypertensive, right? Diphenhydramine, it makes you drowsy. Isosorbide mononitrate, because orthostatic hypotension. Glipizide, also do the same thing. Tarazosin, do the same thing. How that glipizide? Because of hypoglycemia, and they're going to fall down. Diazepam, drowsy, and make you fall. So all of them, the nurse should be concerned about. In this patient who is 89 and he has a vision problem. And let's provide care for a client with what? Increasing intracranial pressure. So ICP is going up. Which finding the nurse should see first? That means what's the first thing you see when somebody ICP is going up? Not the fixed and dilated people. This is a large stage. Change stroke breathing. This is about to herniate, large stage. Nausea, changing level of consciousness. This is good. And hypertension and bradycardia is the last stage. Okay. Next question. The next provide care for a client or provide care for a newborn admitted for what? Kernicterus, right? Which finding the nurse should expect to be consistent with the diagnosis. This is a tricky one. Kernicterus is kids whose bilirubin is so high, it's greater than like 15, make them yellow, and then the presence of kernicterus means your brain is affected by the bilirubin. It's not because you have higher bilirubin. Watch, be careful. Presence of kernicterus it means you have some form of encephalopathy. That means the brain itself is being affected by the high bilirubin. Therefore, symptoms consistent with kernicterus is all about the brain, not the level of bilirubin. Jaundice does not define that. Hypotonia is not. Usually they're going to be hypotonia and they will have poor feeding, not excessive. They have poor feeding and they have lethargy. This is good. Jaundice is not one of them, but they have lethargy. Jaundice is not one of them, but they have hypotonia. This should say and hypotonia. This question is emphasizing the definition of kernicterus does not include jaundice, even though jaundice causes the problem. Therefore, there's only one answer choice there. It's a selected apply. So if you pick more, you're going to get it wrong. And let's receive the following orders. 500 milligrams ciprofloxacin over 30 minutes. The drug dose come in 500 milligram over 100 ml of 0.9 saline. Calculate ml per hour, the next you administer. When they give you a question like that, we write it into those calculations. So I want to achieve this ml over an hour. And you start with the first thing they've given you, right? This is what you've been given, 500 milligram of Cipro over 30. That's what you want. But what is available, I have to, before I do that, I look at it, this is an hour, I have to convert this. So 60 minutes is over an hour. And this will take care of it. Then you take your available at 500 over 100 ml. I want 100 ml to be on top, so I put an ml on top, and I put the 500 below. Then you cancel ml, cancel ml, 500, cancel 500. This, cancel this, you have 2. So the answer choice, 200 ml over an hour. That's the way you do it, dimensional analysis. Okay. All right. And next, provide care for a client who is post-left thoracentesis, which intervention is a priority. They puncture the left lung to remove the fluid, right? Therefore, these areas need to be allowed to recover. That side should never be down, right? Supine position is bad. Left side is bad. They need to lay on the right side so that the left side will recover. Putting the head down is bad. Oxygenation problem. That's how you answer. You see how quick I answer? Yeah, it's our concept. You just write the concept down, and then you see that it's an easy question. Same thing, select or apply. And which medication the LPN should know is not a sulfur drug. That's all. What is a sulfur drug? When on the education, I told you about sulfur drug. Sulfur drug, metronidazole is #1 sulfur drug. If you don't know them, then this is a content review for you so that you can remember all sulfur drug. Allopurinol is a sulfur drug. Furosemide is a sulfur drug. Phenotine is a sulfur drug. Most of the anti-epileptics are sulfur drug. Carbamazepine, anti-epileptic, right? Amlodipine is not a sulfur drug. Therefore, 1 to 5 are your right answer, which are sulfur drug, right? But the answer choice is asking you which of this is not a sulfur drug. So there's only one answer choice there you should pick. That is what? The answer choice you should pick is number 6. So 6 is not a sulfur drug. The rest of them are all sulfur drug. So all of them are sulfur drug. Question asks you not. So 6 is the wrong answer. Or the right answer, basically. You got to pick number 6. Number 10. And then review a client's medication list after a new prescription for lithium. Which medication the nurse should be concerned about? Select or apply. Let's take in strategy. I'll break down the question. Patient is prescribing lithium. Which medication the nurse should be concerned about? That means you should not take anything that will make lithium toxic. What are the things? Sodium, right? It should be normal. Okay. NSAID, it affects your kidney. You should not do that, right? Diuretic, you should not take it. It makes you dehydrated. ACE inhibitor, it decreases your sodium. Therefore, this is enalapril, hydrochlorothiazide, NSAID. Clozapine, antipsychotic, can be used for agitation, bipolar. Risperidone, antipsychotic, can also be used in the bipolar patient. These is some of the things you have to know, right? 1, 2, 3 are your right. And let's provide care for a client in comfort measures due to metastatic brain cancer. The client reports increasing discomfort when the head of the bed is set at what? 45 degrees. So when the head is set at 45 degrees, which intervention by the nurse is a priority? When you raise the head up to like 45 degrees, they start screaming. Therefore, what do? You want to give them pain medication? It's not going to solve the problem. If you don't lift the head up, there's no problem with it. You want to massage the neck because it's weak. This is not a muscle problem. You want to lower the head to 30 degrees? Well, it may still hurt. The best is a priority. If 45, they can't, and they're already having a rattle sound or breathing, you know, they're more likely to get aspirate. So keep them NPO. This one is a test taking strategy. If you can sit up with the head up, then you should keep them NPO. Otherwise, they will aspirate silently. And let's provide care for a client with new diagnosis of atrial fibrillation. Which intervention the nurse should prioritize? Key concept, when you see atrial fibrillation, try to control the ventricular rate. So ventricular rate is what makes them symptomatic, and therefore this is number one priority. I want to make sure the rate is controlled before even I think about anticoagulation. So warfarin does not control rate. Daron, you see what he looked like? You may not have seen it before. It looked like amiodarone, right? It's the same thing. Amiodarone. They are in the same class of medication. Therefore, you should pick it. There's no need for cardioversion because the patient does not have symptoms. And aspirin is not indicated. Next question. And let's provide care for a client with new diagnosis of diverticulosis. Which intervention the nurse should anticipate? Select or apply. What causes diverticulosis? That's all. Because of lack of fiber, no exercise, no hydration. Therefore, my answer choice should encompass all of this. The prescription for Miralax, no, we're stimulating you to go. We want you to go on yourself. So get some fiber. Docolax is the same thing, stimulation. Metacellulose, yeah, you're just taking some fiber. That's good. Psyllium axe is also fiber. And a wheat grain dextrin, that is the benefiber. So that is benefiber. So 3, 4, 5 are your right answer. A little bit confusing, but that's the way to get you thinking some of these questions, make you some of them hard, some of them straightforward, and you can see the variation in each of these questions. And let's provide care for a client with new diagnosis of SIADH. Which intervention the nurse should prioritize? What is the problem with SIADH? Too much water because of what? ADH. So you hold on to your water and your vascular system, you are fluid overloaded. What is the problem? It dilutes your sodium and you get seizures. Therefore, what do you want to do? Nothing to do with potassium. There's no evidence of EKG. Seizure precaution, hyponatremia is number one. Monitor for hypotension. You think they will be hypotensive? No, it's because they're absorbing all their water. They're usually hypertensive, fluid overloaded. So number 4 is the wrong answer. And accidentally sustains needle stick injury when drawing blood from a client with HIV and CD4 count of 100. What is the next first action? Think about it. Patient has HIV, CD4 count is 100. You stack yourself. What do you want to do first? Do you call your supervisor? He or she will say, get out of my face right now. You go and visit occupational health. You say, get out of my face right now. You start taking medication to prevent getting HIV, the doctor will say, get out of my face right now. You got to wash the area first. Clean the area, because that's the most important. That will prevent further exposure. Okay, to prevent further exposure, you wash your hands. Order the following steps and then should prioritize after a needle stick injury from a client with HIV. Once again, all these questions are concept. I intentionally said them. I took my time that I thought about questions that are likely to be asked you, and it's all concept. You stack yourself. What are you going to do? I already told you. Wash the area first, right? Then you let your supervisor know, right? That this is what happened to me. Because of that, I got to assess the exposure. That means the area that you will stick How did it look? Skin breakdown or anything like that? No. So that's number 3. Then you evaluate the source. Does the patient have any other medical problem, any STDs, anything? So you got to draw HIV on them. You got to get a hepatitis B, C, all of them. You got to do extensive workup. Then you go and get your pill within 72 hours. So please, you're right. So 1, 2, 3, 4, 5. That's what will happen. Steps you should take. And let's provide care for a 6-year-old with a heart failure on Digoxin. What intervention is appropriate? This is asking you, how do you know what to do with Digoxin when the patient heart rate is down? Know the 60, 70, and 90. 90, neonate, 70, a younger kid, and then 60 older. This 6-year-old is younger. Therefore, what are we going to do? 70, less than 70. Next question. 17, and it's preferred to administer Otic drops to the 3-year-old client. What action is appropriate? Whenever you see this question, don't worry, don't panic. Bring your head to things. The only thing they will ask you is which direction you pull your hair, right? For a younger patient, less than or equal to 3 years, the only is a downward motion. For older patient, upward motion. That's all, right? So the other test taking strategy, you never push the ear forward. So that's already go. So they're all going to be back. But which way do you pull the peanut, right? Downward. So we are going down and back. Next question. And this is providing teaching to a 25-year-old nulliparous client at 18-week gestation. Which teaching is appropriate? So first pregnancy, 18 weeks. Which teaching is appropriate? This is just basically concept about OB. Non-stress test to see if the PP is doing well, we usually do it at 36 weeks. Contraction test, if the non-stress test is abnormal, we do it 37 weeks. You know, the first trimester is supposed to gain up to 4.4 pounds. That is good. Therefore, I got to pick this. Alpha-fetoprotein elevated, it means Down syndrome. No, it's not Down syndrome. It means there may be some Down syndrome. So they have to do more genetic testing, but they don't base on alpha-fetoprotein alone because there is other diseases that can cause that problem. And let's provide care for a client post transurinary resection of the prostate. Client data for 2 hours below. Intake is 600, output a liter. What action should they need? So most likely this patient is getting 3-way catheter. So you're getting 3-way, this is 1, and this is 2, and this is what is going to the ureteromeatus, right? So I'm irrigating, putting about 500, 600 ml in, and I'm getting what, a liter. That means urine output is 400, right? In 400 urine output over 2 hours, that's more than 30 cc. Therefore, don't call the doctor. Don't need to irrigate. You don't need to obtain CVC. You document the finding. It's a hard one, test taking strategy, but you know it because you watch at that point. And I know you can't answer that. And this is caring for a client diagnosed with obsessive compulsive disorder. Which prescription the nurse should anticipate? Let me show you some strategy, test taking strategy, right? Obsessive compulsive is a mental health problem. Then you look at the answer choice. They're asking you which one. I see allopurinol. Is it a psychotic problem? If you've heard it before, yeah, you got to pick it. Lamictogen. Is he a mood disorder like bipolar? Bupropion. Is he another depressive disorder? And paroxetine. The key is, this is also, it's a mental health, right? The problem is to reduce the anxiety associated with the problem. So SSRI is a first line of choice. SSRI will help this patient stop what they're doing. So that's for that question. Next one, number 21. And that's ascertain the staff education program on client identification process. Which of the following the nurse should recognize as an approved client identification selected apply? So which one can you use in the hospital to determine the patient? Your name, medical record, or sometimes a phone number when you combine it with another identifier. Radio frequency identification, where this has to be scanned and then put in the system or a barcode. These are all things being developed where you can have radio frequency identification. You don't have to have multiple unband, and we can just scan you once. That's technology. Next question. And let's provide care for a client with what? Latent tuberculosis prescribed rifampin. Which laboratory tests need monitoring? This is, you got to think about this kind of question. When it's very short, it means it's loaded. So you have somebody with the latent tuberculosis being prescribed rifampin. What do you do? Do you check their urine-specific gravity? Do you check their CBC, liver function test, or pregnancy test? I know you people can get trapped with this, right? It makes birth control ineffective, but that doesn't mean that you have to check pregnancy on. You just teach them that hey, you can't take contraception. You make the oral contraception ineffective, but nothing to do with the pregnancy, right? At the same time, is a latent TB patient, so it does not need in isolation any problem. 2. TBC, what is it going to provide you? There's infection, urine-specific gravity. What is it going to tell you? So the right answer is a liver function test where you see what the liver, all PPD medications affect the liver. So that's that. Number 3 is your right answer. NSS provided teaching to a client with grave disease. The LPN reinforced the teaching. Which statement indicate effective teaching? So this is also a good one. It's all test-taking strategy and content. Patient has grave disease, and we provide teaching. What do you know about grave disease? It's due to high thyroid hormones, and their metabolic rate is very high. And based on that, there's certain features you see. They lose weight. They cannot gain weight. So going to the gym to lose weight, it does not indicate effective teaching. I will increase my fiber intake to prevent constipation. They have diarrhea. So I will wear warm clothes when outside. They have cold and warm intolerance. Therefore, they should not do that. I'll go to the emergency room with palpitation, fever, and diaphoresis. Yes, this is thyroid storm. Too much excessive stimulation of the thyroid hormone can do that. And so effective teaching is number 4. So like I said, all these questions are designed to test your mind. So I know if it sound like they had, sorry, but that is the purpose of that. An LPN obtained a client's blood pressure. The value was taken above the Phlebostatic axis. What reading should the nurse expect? Once again, it's a concept. If you know what Phlebostatic is located, if the individual is sitting down, you count 4 intercostal space, you draw a line in the middle, and you draw a line across the anterior clavicular line, and where intersect patient head is here. That's what we call Phlebostatic axis. If you are above it, your reading for your blood pressure will be low. If you are below it, your reading will be high. So what did the patient do? Was taking above it, I expect a low blood pressure. So a low blood pressure here is good. High is good. Blood pressure specific for the patient is not good. Elevated diastolic alone is not consistent. Therefore, that's the way you should answer the question. And let's provide care for a client with narrow angle glaucoma. Which prescribed medication the nurse need to clarify with the ordering physician? Concept. If you have glaucoma, well, there's some enzymes and medication you should stay away from, no matter what. Medication you should stay away from is specific, and you should not even try because they are very dangerous. And they may worsen the individual glaucoma. I call them the antihistamines. Stay away from it. And so terminal is what is used for the treatment, right? It's a law to help with the people function, and that can prevent worsening of glaucoma. It's the treatment for glaucoma, and that's what you depend on, right? This is not good. You already know what it is. So it's one of the H2 antihistamines is bad. Anticholinergic is bad. Antihistamine is bad. It's an alpha blocker. So those are the things you should avoid. Antihistamine, anticholinergic, and decongestant. These are medication you should never give to a patient who has glaucoma. So 2, 3, 4, 5 are your right answer. She should clarify those medications. And nurse is teaching a client with left ankle sprain. Client is allowed partial weight bearing on each leg while using crutches. Which clutch walking gait is appropriate? Think about it. Partial weight. Again, so you have crutches, you broke your leg. So this one leg, and you can bear weight on them, right? If you can bear weight, that means they can touch the ground, right? They can touch the ground, but not full. And then you have your crutches too. So what is that motion with that? I can show you test-taking strategy. 3 points means that one leg that is fractured cannot touch the ground. So you have 1, 2, 3. Okay? Then 4 point is a full. Basically, you have full, it's completely touching the ground. Basically, it's completely touching the ground. Right? And then 2 point, what do you think? What do you think about 2 points? 2 point gait. So for the 2 point and the 4 points, you have full weight gain. So you have like no weight gain, full weight bearing. So it's the most stable one. Both legs can touch the ground, but you fully touching the ground. You're completely touching the ground. There's no like a partial weight bearing. There's full weight bearing. And swing through is basically amputation. You're just swinging through. Therefore, 3, you cannot touch any of no foot. One of the foot that is injured is not touching the ground. 4, you can touch the ground and you can bear weight on it. 2, it just doesn't. You can't bear weight on it. So this would be a 2 point stand. So this, if you use 2 point gait when walking in this situation. Since they can only bear weight partially. And it's providing teaching to a client prescribed nasal decongestant. Which teaching is a priority? Like I said, these questions are one-liner to disturb you, to make you feel like you don't know, but intentionally designed. What would you see? Prioritization. These decongestant, most of them have like epinephrine, pseudoephedrine, especially like that. The vasoconstriction, they will increase your blood pressure, they have rebound effect. Therefore, jittering and nervousness is expected. But it's not a priority. You should not hold your blood pressure because you make your blood pressure high. So you should take your blood pressure still. You should limit it to 5 days because after 5 days, even though it's a decongestant, it causes vasoconstriction and get away and prevent the mucus secretion in your nose, and you feel much better. If after 1 week and you after 5 days you still taking it, you get a rebound and you have more mucus and you have runny nose more. So if you have noticed it, you start taking these Sudafeds, and then after 5 days you still taking it, your condition get worse. So this is the right one. It will take 7 days. It will take 5 days for it to be effective. If 7 days you still taking it, it means it's ineffective. Number 28. A nurse has attended the staff education program on the course of hyperkalemia, which condition selected by the nurse as a potential cause of hyperkalemia indicate effective teaching. Therefore, all I will be saying is what will cause hyper-K. Aldosterone, too much aldosterone will lead to decreased K. Cannot be this. Addison does not have aldosterone. It's going to lead to K. So that's Cushing. Cushing, through its effect on sodium, will not cause hyper-K. Prolonged NG tube, you're going to lose your potassium, and therefore you're not going to have hyperkalemia. It makes sense, right? Hypochloremic, hypokalemic, metabolic alkalosis, prolonged NG tube, you're not going to have your potassium is going to be low because your sodium is low. Metabolic acidosis, so you have acid here. If you push it inside the cell, you replace it with potassium. So that will increase potassium. Therefore, 2 and 5 are your right answer. The client with the pause, diaphoresis, blood pressure this as the strip below on the monitor. First, read the monitor and see what we have. This is VTAC, right? Then what happened? You have a pause. So I'm good. I have some time. But the patient is ready. His blood pressure is 70. Sweaty, blood pressure, this is symptomatic. What would you do? The patient has symptoms. You got to act fast. CPR, does not require shock. CPR right away because the patient has pause. Defibrillation, this is not a defibrillator rhythm. It's not shockable. You do synchronized cardioversion because medication at this time is too late. My blood pressure is low, I'm sweaty, and I have symptoms from the VTAC. So synchronized cardioversion. And then upon entering a client's room, the nurse observes a fire in the bathroom. The nurse has rescued the client from the room. What action the nurse should take first? This is something you already know, but I'm trying to trap you, right? You remember fire? Raise. So you rescue people. You already went to the room, you observe the nurse there. Say after the nurse has rescued the client, you go to A. You alert the fire department to come and take care of their job. You see how funny that question is? It's all content. And then provide care for a client prescribed bisphosphonate. Bisphosphonate, which condition in the client history will cause the nurse to question the prescription. There's a concept there I want you to know. Bisphosphonate is taken with the full glass of water. You take it in the morning. You remain upright for 30 minutes. Key, upright for 30 minutes, full glass of water. Why? Because it's esophagitis, and it can cause stricture of your esophagus. Therefore, which condition is bad? You can have acid reflux. That's not what I mean. Stricture in esophagus, yeah, that's a big problem. Crohn's disease is not an issue. Osteoporosis is the reason why you take bisphosphonate, so it's not contraindicated. So the right answer is number 2. Right answer is number 2. An infant is in the cardiac arrest and unresponsive. Which artery the nurse will palpate to assess for pulse? So this is an infant. Where do you assess for pulse? We check the carotid, We do check femoral, dorsalis, or brachial. So the right answer is brachial. The carotid is for adults, so we do a brachial. You don't want to go into the femoral or dorsal fetus. So this is the right answer. Next question. LPN is reinforcing teaching to a client prescribed home peak flow meter for asthma control. Which statement indicate teaching is effective? These are things you have to know at the fingertips. I bet you these are good questions they ask all the time. So this is the flow meter that the patient is going to blow, and there's gauges here, and the gauge is here, like level, right? How do you do this? Your personal best is what it is. That means if you measure 1, 2, 3, you do 1, 2, 3 measurement, and one is highest, that's what you take, not the average. So this is not good. I will move the indicator to the top of the normal scale. The top of the normal scale is here. You should leave it at the bottom of the normal scale so that when you blow it, you just move the thing up to indicate where you can land. I'll blow as hard and quickly as possible. Yes. I will wait 10 seconds after each fast, hard cough. 10 seconds is too long. It's too short. You need 30 seconds. Remember, this is expiratory problem. So you blow out, not in. You blow what? Out, not in. It's an expiratory problem. Watch for that trap. Okay. Number 34. And then observe a UAP provide care to several clients. The next you intervene if the UAP fails to use airborne precaution with which client. You have to know your airborne precaution. Positive matters test and X-ray is normal. This is standard precaution. HIV, standard precaution. Pseudomonas aeruginosa, this is contact. Measles, airborne. Chicken, pox, airborne, and droplet. West now is standard precaution. 4 and 5 are your right answer. And then ascertain the staff education program on 4 risks for elderly. Which factor the nurse recognize pose the highest risks for a fall in the elderly? That means if you have an elderly patient who fell down, who you think is as highest risk of fall, which of those you think will put them at higher risk of fall? This is a really good question. Think about it. Just because they're old, or they are in a nursing home, or they are in a hospital, or they are home. If they are home, they're protected. Being old doesn't mean you're going to fall. Hospital is bad. Unfamiliar environment. That's where people fall. If you know where you are, the resident home, they've been living there, so they know everything. It's hospital, they have no clue. So 3 is your right answer. That's the one that pushes you at risk. The nurse provide care for a client with diagnosis of bacterial conjunctivitis. Which finding the nurse know is consistent with the diagnosis? So which finding the nurse know is consistent with the diagnosis? Select order that apply. Bacterial conjunctivitis is a contact precaution. We get an antibiotic in your eyes. There's 3 types: allergy, bacterial, and viral. Watery and serous discharge is mostly virus cause. Return to school immediately after antibiotic. You have to waste 24 hours course of antibiotic. This is wrong. Wipe your eyes inner, inside, out, so that you don't infect the other one, the other eye. In the morning when you wake up, your eyes will be crusted and shut. It's common. Use your warm cloth to help take away the crusted and then get rid of everything. So 1, 2, 5, 6 are your right answer. You should know conjunctivitis, the viral and allergic form. Next, provide care for a client in emergency department. Client report progressive loss of peripheral vision with intact central vision. Which client is the client is most likely suffering from what? So, test taking strategy. This is the patient. They cannot see peripherally. I can't see here, but I can see right in the middle. That's what we call what? Glaucoma. Cataract, that means the lens is crowded. Macular degeneration is located in the middle, so they cannot see in the middle. Retinal attachment, you feel like fluid is falling over your eye, and it's acute onset. There's no pain described in the question. Let's take in strategy. The LPN is providing care for a client with HIV. Which action is appropriate? Don a surgical mask, don gown and gloves, and hygiene before, after, don N95. HIV is a standard precaution, so leave them alone. Just wash your hands when you care for this patient. That's all. I told you it's all concept then. So that's why I don't waste time. Easy concept to figure out some of the answers. And then observe the UAP provide care to a client. Which action require intervention by the nurse? Select or apply. That means the UAP is doing something wrong, right? Don a new sterile gloves. You're not supposed to wear sterile gloves when you're caring for routine care, right? Or perineal. After you care for a perineal, you should just wear for non-sterile, right? So require intervention. Don non-sterile gloves before performing personal hygiene. Yeah, you wear gloves before you do the personal hygiene. Perform hand hygiene before and after. That's good. Perform hand hygiene after. Perform hand hygiene when it's and then or wash the hands with soap and water when visibly soil is right. So which one require intervention? It's only one. That's the only one who will require intervention. Few more questions. And let's observe the LPN provide care to a client. The nurse should intervene if I will intervene if what? Latent TB is in semi-private room. Latent TB means PPD positive. You can be in a semi-private room or you can be co-ordered. Semi-private means co-ordered. There's somebody there. A client with rubella, airborne, good. Scabies, room with pediculosis. The idea is not the precaution. Both of them are contact precaution, but they are different organisms. Rubella is droplet. So 3 is your right answer. The LPN is reinforcing teaching to a client prescribed prednisone. Which medication side effect due to long-term use the nurse should include in the teaching? Break it down. Simple question. What is the long-term side effect of steroid? Osteoporosis, you have ulceration, you have cataract, you can go into psychosis, depression. Those are our side effects of long-term use of steroid. And then ascertain the start of education program on COPD, which finding the next no is consistent with bronchitis. Select or apply. There's 2 types of COPD. There's emphysema and bronchitis. One is due to air trapping, the other one is due to secretion. Bronchitis is major secretion, how to clear your secretion, right? Your chest is not barrel. You have secretion problem, you have recurrent lung infection. If you have secretion problem, we're going to give you guaifenesin. If you have secretion problem, you're not going to develop pneumothorax. If you have secretion problem, you're going to use huff cough to improve your oxygenation. That's the way you answer questions, adapting this way. 43. And then ascertain the staff education program on COPD. Which prescription the nurse should prioritize in a client with acute exacerbation of COPD? So acute exacerbation of COPD, which one you want to include? Remember, there's mostly vasoconstriction or bronchoconstriction causing the problem. So we're going to open it and give you a border. This is going to make the condition worse. The blocker is not good. Then this is a non-selective. It affects COPD patient. Antiglucose is long-term. Morphine, who depresses their respiratory rate. So 1 and 2 is the right answer. 44. And then ascertain the staff education program on diabetes insipidus. Which finding is consistent with the disease process? Select or apply. What is diabetes insipidus? is basically no ADH. So the urine output is going to be high, whether you like it or not. You're going to get rid of it. Or your urine is diluted. So low urine, because your urine is a lot high urine output and it's made up of just water, your urine specific gravity is supposed to be low. If your specific gravity is low, sodium is going to be in the urine is going to be low. Since you're losing water, your serum osmolarity is going to be high, not low. And since serum osmolarity will be high, serum sodium is also be high. Prescription for desmopressin is ADH. So that will prevent the breakage or whatever is going on. Demicycline is used to block ADH. You should not be blocking ADH. Therefore, the right answer is number 5. That's our answer choice. And the last question. NS is assessing eye examination on a client with the eye injury. Which cranial nerve the next node is associated with eye movement? There's a couple of cranial nerves associated with eye movement. 1, 2, they're not involved with the eye movement. 3, 4, and 6 are involved in the eye movement. 5 is what we call what? Trigeminal neuralgia. It's mostly pain. So the right answer is 3, 4, 6. This is adapting class. Thank you for your time. Thank you for going to the end. I know you learned something because it's our content you have to know. If you like this video, share it. Join our membership or our crash course. In the membership, you learn. In our crash course, we learn to the top, and we have on-demand course with QVATs. So check adapting class, and you'll be good. Best of luck. Keep charging. As always, bye.